Foi fácil.
Foi fácil.
It was easy, they say. Portugal has been vaccinating children for a week now. The kids are following in their parents' footsteps. With a vaccination rate of around 88%, the country is leading Europe. Parents are trying to protect their children from the disease and are confident in the vaccine. But does that mean the end of the pandemic is in sight for Portugal? Welcome to your COVID-19 special. I'm Daniel Winter. Portugal is a vaccination success story, and that success is reflected in the dramatic fall of the death rate there. But with the threat of a winter wave of infections and the new Omicron variant, authorities in Portugal aren't keen to relax restrictions just yet, as DW's Jan Philip Schultz reports.
Every morning for almost 2 years now, Dr. Tiago Serra has been doing his rounds of this hospital's COVID ward. At the moment, 24 of the 30 beds are occupied. It's not a relaxed situation, but not as bad as it was during last winter's catastrophe. Back then, his hospital in Amadora, a Lisbon suburb, was at the verge of collapse.
It was very difficult because there were very young people, very sick with serious disease, and we had to convert almost of this hospital into COVID-19 beds.
The doctor says he's confident that Portugal's successful vaccination campaign has helped avoid spiraling cases this winter. Here, 88% of people are immunized. That's a higher rate than in most of Europe. Nevertheless, the number of infections is currently on the rise again in Portugal. The government has reacted quickly. Since the beginning of December, even vaccinated people need to show a negative test on arrival. I think it's good. Everyone has to do their part so that they don't infect anyone else.
You can be vaccinated and still have COVID, so I guess the test works.
This is a world health situation, so yeah, I do believe it works well, and I do believe that it's something that it should be done.
All over Portugal, people can now get tested for free. The lines are long because starting last week, both vaccination and testing became mandatory to visit many venues.
Rising infection numbers and strict measures. For some critics, the Portuguese example serves as evidence that the vaccination campaign has failed. But they overlook the fact that the vaccinations deliver what they promise when it comes to the most important of all criteria. Hardly anyone in Portugal dies of COVID anymore.
Even in Tiago Serra's ward, all patients are either unvaccinated or have pre-existing conditions. Despite the vaccine success, the doctor is worried that his ward could soon fill up again. The Omicron variant and the Christmas season are a risky mix, he says.
It's a time where people tend to relax a little bit more with the social distancing, and I think it's important for people to realize that this is still between us, that we need to take care, and some sort of restriction measures will still have to be necessary.
Portugal's government has already announced that it will put the country into a week-long preventive lockdown immediately after Christmas. Authorities say another collapse of the health system should be avoided at all costs.
And Mariana Perez Duque is an infectious diseases epidemiologist joining us now. Thank you very much for speaking with us, Mariana. Surely when a country has reached such a high vaccination rate, it should be time to get rid of mask wearing and lockdowns, right?
Well, I would start by saying that indeed Portugal stands out as having one of the highest vaccine coverage rates for childhood vaccines, but also for COVID-19 among European countries, but also globally. And this is due to excellent vaccine convenience and confidence levels. The mass vaccination for COVID-19 in Portugal is ongoing now, with the third dose being offered to high-risk groups. And despite of a high vaccine coverage, the event of a new variant is always a risk when we have such a high community transmission worldwide. On the top of a Delta variant wave that was already leading to increasing numbers of new cases, we now face a new variant, Omicron, which preliminary results also show us that is more transmissible than Delta itself, even among vaccinated people.
Okay, but we've been told to accept COVID as being endemic, right? So that it's here to stay. So what would be the right criteria for ending restrictions?
Well, we need to be ready to scale up and scale down a package of public health measures that have been applied and that we know that they result. They need to be applied regarding the epidemiological situation and also our availability to cope with the pressure of new cases in the healthcare system. Of course, the ultimate goal is to tackle the impact of the socioeconomic measures on the pandemic for the people. But as long as we have new variants happening worldwide, we cannot scale down even among vaccinated people, now that we know from preliminary findings that Omicron has the capacity to evade in such a grade this immunity.
So it's building in the right logistics and flexibility into the system to be able to react when new variants come out, you say. What's been the reaction in Portugal to the renewed lockdown and the measures there?
Well, Portugal has been managing the risk with massive testing, isolation of cases, and contact tracing procedures, together with this package of public health measures that have been scaled up and scaled down, depending on the risk for the country to cope with. Well, there is no one-size-fits-all approach to promoting public health measures compliance, and in a situation where the health system does not have the capacity to receive and treat patients, more dramatic measures might be needed. At this point, the country is still coping with the current epidemiological situation, and a general strict lockdown would be the last resource to its massive economic impact.
And how does Omicron change how we think about the challenge ahead? Because I believe that factored into the decision-making when it came to the lockdown after Christmas.
Well, indeed. So the vaccination plan in Portugal so far has been updated with a surge of new evidence, and it's dynamic to account for epidemiological situation and availability of vaccines. The preliminary results from Omicron cases in South Africa, they suggest that the effectiveness of a 2-dose vaccine scheme might be slightly reduced against this new variant. And also, a similar study by Pfizer-BioNTech suggested that their COVID-19 vaccine offers a better protection for 3 doses than for 2 doses only against this variant. These two phenomena are responsible for this would be waning immunity and the evasion capacity that Omicron has showed in vitro studies to evade, again, this immunity that we have been building up with vaccines and also from infection.
OK, and it seems that the rest of the world has quite a bit that they can learn from Portugal. Mariana Perez-Duque, medical doctor and infectious disease epidemiologist, thank you very much for giving us your insights. Well, it's now time for you to ask and for us to answer. Here's a viewer question about the other types of coronavirus for our science correspondent, Derek Williams.
What other types of coronaviruses are out there?
Hundreds of different coronaviruses have been identified to date, and there are many, many more out there. But the ones that interest us most are, of course, the ones that infect us, which are known as the human coronaviruses. 7 of those have been identified so far. 4 only cause mild cold-like symptoms and are considered endemic, which means that they circulate widely, especially in the winter. Though these pathogens are pretty harmless now, scientists speculate that they might have caused much more serious disease in the past, but have adapted, along with our immune systems, to be less deadly today. Then there are 3 much more recent additions to the human coronavirus family that can cause much worse illness from a lineage called beta coronaviruses. There's the pathogen that causes severe acute respiratory syndrome, or SARS, the one that causes Middle East respiratory syndrome, or MERS, and of course there's SARS-CoV-2, which causes COVID-19. One characteristic beta coronaviruses share is that they infect mammals, which means that they exploit similarities all mammal cells have in common to invade and make more copies of virus. It also means that they don't have to change a whole lot to jump from mammal species to mammal species. Many scientists are pretty confident that SARS-CoV-2 originated in bats, like the viruses that cause SARS and MERS. Now, bats are amazing in lots of ways, not least because although they can carry many different viruses, they somehow seem to remain really resistant to the diseases those viruses can cause in other species. Now, we think that the ability has evolved because many bats live in huge colonies where any infection could quickly wipe out really vast numbers of animals. Some research indicates that bat resistance is down to immune systems that come to terms with infections, basically striking a balance with the virus rather than declaring war on it. So bats don't get rid of the virus, but they don't get sick either. Although the superpower, unfortunately, also makes them a reservoir for coronaviruses that can jump to other mammals, like us.